When we think about a heart attack, a specific image often comes to mind. It's usually the story of a middle-aged or older man. He may have, decades of unhealthy habits. These habits lead to the slow buildup of plaque in his arteries. This plaque, a sticky substance made of fat, cholesterol, and other materials, gradually hardens and narrows the pathways that carry blood to the heart. Over time, a piece of this plaque can break off. This event triggers a blood clot to form, completely blocking the artery. The result is a classic heart attack, known as a myocardial infarction. The heart muscle is suddenly starved of oxygen-rich blood, and it begins to die. This is the narrative we have seen in movies and health campaigns for years. This traditional understanding is not wrong. It accurately describes many heart attack cases, particularly in men. This model has shaped how we diagnose and treat heart attacks for a very long time. For example, doctors look for blocked arteries using tests like angiograms. Treatments often involve procedures like stenting to open the blocked vessel or bypass surgery to create a new path for blood flow. Medications that target cholesterol and prevent blood clots are standard. This approach has saved countless lives. It is based on a clear and well-researched cause. However, this story is not the complete picture. For a significant group of people, this explanation does not fit at all. This long-held view has created a standard of care that works well for many patients. The problem is that it can create blind spots in the medical community. When a patient does not fit this classic profile, their symptoms might be misinterpreted or even dismissed. This is especially true for younger women. They are not the typical face of heart disease. Their symptoms can also be different. Instead of crushing chest pain, they might experience fatigue, shortness of breath, or pain in the back or jaw. When these women arrive at the emergency room, doctors might not immediately think of a heart attack. This can lead to dangerous delays in diagnosis and treatment. The assumption that all heart attacks stem from clogged arteries has been a cornerstone of cardiology. This belief has influenced everything from public health messaging to the training of new doctors. It has led to incredible advancements in treating plaque-related heart disease. We have developed powerful tools and effective medicines based on this model. But what happens when the cause is something else entirely? Relying too heavily on this single narrative can leave many patients vulnerable. It's becoming increasingly clear that we need to broaden our understanding. We must look beyond the familiar story of blocked arteries to solve the full puzzle of heart disease. This is particularly urgent for younger women. For a long time, heart attacks were considered a man's disease. We now know this is dangerously untrue. Heart disease is actually the leading killer of women. Recent research is revealing an even more surprising fact. The cause of heart attacks in younger women is often very different from what we see in men. New studies are challenging our old beliefs. They show that the standard model of plaque buildup and blockage just doesn't apply to a large number of women. This is especially the case for women under the age of 65. Their heart attacks are frequently caused by other, less understood mechanisms. This discovery is forcing the medical world to rethink its approach. A groundbreaking study provided a startling statistic. It found that only 47% of heart attacks in women under 65 were caused by the classic scenario of a blocked artery. This means that in more than half of these cases, the cause was something else entirely. Imagine going to the hospital with heart attack symptoms, only for doctors to find your arteries clear. This can be a confusing and honestly frightening experience. It can also lead to misdiagnosis. If a doctor cannot find a blockage, they might conclude it was not a heart attack after all. The patient might be sent home with a diagnosis of anxiety or indigestion. This leaves the real underlying problem untreated and likely to happen again. This new information is a critical turning point. It tells us that for a majority of younger female patients, our standard diagnostic tools might not find the answer. An angiogram that shows open arteries does not mean the heart is fine. It means we need to look deeper and consider other possibilities. The assumption that a heart attack must equal a blockage is an outdated one. This knowledge empowers both patients and doctors. It encourages them to ask more questions when the initial tests do not provide a clear explanation. It highlights the need for a more personalized and investigative approach to heart health in women. The implications of this research are enormous. It changes how we should approach diagnosis, treatment, and prevention for younger women. It is not enough to focus solely on cholesterol and lifestyle factors that lead to plaque. We must also learn to recognize and manage other potential causes of heart attacks. This shift in perspective is vital for improving outcomes. It means training doctors to think beyond the usual suspects. It also means educating women about the diverse nature of heart disease. Understanding that a heart attack can happen, even with clear arteries, is the first step toward better protection and care for millions of women. If blocked arteries are not the cause for more than half of young women having heart attacks, then what is? Researchers have identified several other major culprits. One of the most significant is spontaneous coronary artery dissection, or SCAD. This is a condition where a tear forms in the wall of a heart artery. Blood can then seep between the layers of the artery wall, forming a blockage that cuts off blood flow to the heart. SCAD is not related to plaque buildup. It is the leading cause of heart attacks in women under 50 and is also linked to pregnancy. It's a completely different mechanism that requires a different treatment approach. Another important cause is an embolism. An embolism occurs when a blood clot forms somewhere else in the body, breaks free, and travels through the bloodstream to the heart. Once it reaches a coronary artery, it can get stuck and block blood flow, causing a heart attack. This is different from the clots that form directly on top of plaque. These clots can originate from the legs or even from the heart itself, especially in people with certain heart rhythm problems. The treatment for an embolism focuses on finding the source of the clot and preventing new ones from forming. It's a detective story that goes beyond just looking at the heart's arteries. Stress also plays a powerful and often underestimated role. Intense emotional or physical stress can trigger a heart attack, even in people with perfectly clean arteries. One such condition is called Takotsubo cardiomyopathy, or broken heart syndrome. This is a temporary weakening of the heart muscle that is often brought on by a sudden stressful event. The symptoms can mimic a classic heart attack, but the arteries are not blocked. While most people recover, it is a serious condition that shows the profound connection between our emotional state and our physical health. Chronic stress can also contribute to other heart issues, making it a critical factor to manage. The problem is that these alternative causes are frequently missed. When a young woman has a heart attack and her angiogram shows no blockages, the medical team may be puzzled. Without specialized knowledge of conditions like SCAD or embolism, they might not perform the right follow-up tests. This can lead to incorrect or incomplete treatment. For instance, putting a stent in a dissected artery, like with SCAD, can sometimes make the tear worse. Giving standard clot-busting drugs might not be the best approach for every situation. Recognizing these different causes is essential to providing the right care and preventing future heart events. The first step towards solving this problem is awareness. Both women and their healthcare providers need to understand that heart attacks in younger women often look different. Women must be encouraged to trust their bodies. If something feels seriously wrong, it is important to seek immediate medical help, even if the symptoms are not the classic ones. Do not be afraid to be your own advocate. If you are told everything is fine but you still feel unwell, ask for a second opinion. Ask if conditions like SCAD or other non-obstructive causes have been considered. Pushing for answers can be life-saving when the cause of your symptoms is not immediately obvious. At the same time, the medical community must evolve. Doctors, nurses, and emergency responders need more training to recognize the varied symptoms and causes of heart attacks in women. When a younger woman presents with potential heart attack symptoms, a normal angiogram should not be the end of the investigation. It should be the beginning of a new one. Providers should be prepared to look for SCAD, embolisms, and signs of stress-induced cardiomyopathy. This requires a shift from a one-size-fits-all protocol to a more curious and thorough diagnostic process. This change in mindset within our healthcare systems is crucial for closing the gender gap in heart disease outcomes. The good news is that we are making progress. Thanks to dedicated researchers and advocates, our understanding of women's heart health is growing every day. We are developing better imaging techniques to diagnose conditions like SCAD more accurately. We are learning more about the unique risk factors that affect women, such as those related to pregnancy and autoimmune diseases. This growing body of knowledge is leading to improved diagnostic tools and more targeted prevention strategies. The future of women's cardiology is becoming more precise and personalized, moving away from the old models that were based primarily on men. This journey is far from over. We have made great strides, but there is still much work to do. We need more research focused specifically on women to better understand these non-traditional causes of heart attacks. We need to continue raising public awareness so that no woman's symptoms are ever dismissed. By supporting research, championing education, and encouraging women to take charge of their health, we can build a future where every woman receives the right diagnosis and the best possible care. Together, we can ensure that the story of a heart attack is one that we fully understand for everyone.